What's good, everybody? It's your boy 6'5" Mir, and today we're here to discuss how times have changed in the transportation industry and the medical industry. In the transportation industry, there has been a significant increase in the drivers, up to 7.9 million in the last 2 years, compared to 2019, where there was only 5.1 million. In the medical industry, there is currently 22 million. I mean, I'm sorry, there was 22 million in 2019, but as of currently in 2022, there is only 5.1 million. So today we're going to discuss a couple of those things and how the numbers have changed and the activity in the industries. Hello, hello. Thank you for coming. So right now, I'm going to pull up my first guest, G Way, and he's going to discuss some of the things that he's done, in the trucking industry. And well, let's bring G Way up so he can talk to us about that.
What up? What up?
What's up? What's up? How you doing, bruh?
I'm doing pretty good, man. How you doing, bro?
I'm good, man. I'm good, man. It's always good to be seen and good to be heard.
Oh yeah, most definitely, most definitely.
If you can you tell us a little bit about who you are, how you are streaming on Tag, and like the times people can catch you if they want to check you out?
All right, all right. If y'all know me by now, y'all can get to know me. My name is G Way or No Way. You probably heard somebody screaming it or yelling it somewhere, somehow. I've been streaming on the app now for about 3 years. You can catch me pretty much almost every night about 9 p.m. Eastern Standard Time. I got a lot going on. I co-host Red Room Talk with Jen and Juice on Saturdays. Also, I have Hood Feud on Mondays at 9 p.m. Eastern Standard Time, where I give away a free jet, which is the ghetto version of Family Feud. And I also got Getting Lit on Thursdays with King of Diamonds, which is another feature show that I co-host on. So if y'all want to know me, you can get to know me. Hit that fade button, come through. I'm normally on, like I said, about 9 p.m. Eastern Standard Time.
All right, y'all. That's G Way. Make sure you guys hit G Way with a fave. What's good, everybody in the chat? Make sure you hit me with a fave. If you haven't got me already, make sure you hit G Way with a fave also. So, G Way, I just had a couple questions for you, man, because I know you're experienced in truck driving. So, do you remember when COVID first was announced, and how did it affect you when you first heard it?
Yeah, I actually do remember when COVID was first announced. At first, it wasn't much of an effect. COVID didn't really affect the transportation industry until they started enforcing the lockdown. Once they started enforcing the lockdown, it just went crazy after that. It's like everybody, for some reason, wanted to drive trucks. I don't know why that is. It's like everybody's like, all right, I can't get out the house. Let me get in the truck.
That's what it was. That's what it was.
For
Everybody
real,
wanted
for
to
real.
get out the house.
Yep.
So, were you scared at any point at that time?
Yeah, because I'm around people every day, all day, like delivering loads, picking up loads. That's a lot of people every day at travel centers or the truck stops. So yeah, I definitely was on high alert with my mask every day, all day.
Okay, dope, dope. So, do you feel like you were a valued worker before COVID, or they said that truck drivers were deemed essential workers after COVID? So, did you feel like you were a valued worker before and after, or just after?
Before and after, but it was like a kick to that because they considered us essential workers, but a lot of us in the transportation field, we didn't get like an extra amount of pay or anything for the government for that, which is crazy. Which I'm still to this day baffled because a lot of people in the medical industry they got government assisted checks or a raise in pay for coming because of COVID. We didn't get anything. Actually, our market pretty much crashed because of that, which was crazy because we had so many drivers and the market pretty much just stayed the same. We had more drivers, had more demand for product, but the product and the prices never changed. You would think it would go up because it's in higher demand, but it didn't. It stayed exactly the same.
Okay, exactly the same. Okay. So how do you feel it was being away? Like you're a driver, you're on the road a lot. How do you feel it was being away from your family, like before COVID versus after? Do you feel like you got more time with your family before, or do you feel like you get more time with your family now?
Before, before, because now business it's booming, because everybody you gotta need something. Everybody needs something. So I went from before COVID, staying out about a good 2 weeks, going home. After COVID, I've been staying out like a
Okay, so
month
you've been on
going
the road
home.
longer.
Yeah, definitely more longer stints on the road now because of COVID.
Okay, okay. So I noticed 2 years ago, the federal they suspended the regulations on how you guys were able to drive long distance of time. So normally they made you guys stop and do like 10 hours in between. It was like,
Right.
oh, after when COVID first hit, they were like saying, "Hey, you guys can drive until you can't drive anymore." Did you partake in that, or did you continue to drive with the regular standards?
I partook in it, but it was only for like a month. I got real burnt out real fast because once they lifted that mandate, anything that you hauled that was essential, like baby wipes or hand sanitizer or face mask, you know, the faster you get that load there, the more they paid you. So it might be a 17, 18 hour trip. You might that day, instead of doing your regular 9 to 10 hours, you might just do 13 to 14, because the quicker you get it there, the quicker you get paid. So yeah, it was really crazy out here. But they had to change it back because there was a lot of accidents happening. A
A
lot of
lot of
accidents
accidents.
from
Yeah,
driver
people were
fatigue.
pretty fatigued. Yeah, I know
Yeah.
it's really dangerous driving those trucks and being fatigued. Um, it's definitely an essential job and dangerous. They got hazmat materials. They do doubles and triples. If you don't know what a double is, when they carry two trailers or when they carry three trailers, so it definitely gets dangerous.
Right.
So once again, everybody, what's up? I'm 6'5" Mir. If you don't know me already, this is how times changed. I got my man G Way right here in the box. He's one of the essential workers of the transportation industry and one of our beloved streamers here on Tag. So make sure you guys hit us both with a fave. Hit some of the people in the chat with the fave also. I appreciate that love. Thank you. Thank you. So another question I have for you, sir, is I know that due to like a lot of the stuff going on with inflation, with the gas prices of diesel versus owner operator versus rolling with a major company have skyrocketed to normally it's like $1,000 to fill up. Now it's skyrocketing to 2,000, 2,500. So if you're with a company, does that affect you? Or if you're an owner operator, I actually don't know which one you are.
I've actually dabbled in both. As a company, it really doesn't matter because that's the company's responsibility for the fuel, and it normally levels out because they have so many trucks and haulers heavy so much product, so it levels out and they still make a profit from it. But as an owner operator, which I tried to do as well during this time, because the COVID, I was thinking kind of opposite. It's gonna be more demand for product, it's gonna be more loads, but like I said, the prices didn't go up like you expected. They stayed exactly the same. While that fuel went up, and as an owner operator, you got to pay for that fuel. So a lot of people that I know that were owner operators actually came off the road. Some of them sold their trucks because they couldn't afford to keep the fuel in it. They wasn't making any profit to take care of their family, so they had to leave owner op and go back to company or just get off the road completely. And I've seen a lot
Okay.
of companies go under that the same way. Like a lot of those small companies, they really went under. I know for a fact 3 of them went out of business that I used to work for. They told all their drivers, "Hey, come park the trucks. We'll pay for y'all a ticket home." And that was the end of it.
Yeah, I've been seeing stuff on YouTube and online about mom and pop companies subcontracting themselves to places like Amazon and FedEx just to keep their business afloat. So, um, did you have that happen to you where you did you continue the regular loads or did they subcontract you out to another company?
Subcontracted. I got
Hmm.
subcontracted. That was the only way to really, still is actually. If you don't have like a subcontract or an account with someone, it's almost nearly impossible to make money out here at this point. The way that the,
Okay.
the gas prices are at this point. you gotta have an account. That's the only way you're gonna
Okay.
make money.
Sounds good. Sounds good, man. It seems like you're really knowledgeable. You've been driving for a long time. How long have you been driving exactly?
10 years. I've been out here 10 years,
10
going on
years.
11 in March.
Okay. Okay. I actually got my CDL uh, when I have a small child. I got it my CDLs when he was born, but I never actually took and got on the road because I didn't want to actually leave my son behind and miss some of those early memories.
Right.
But once you have a CDL, you always have a job. So
Always. Always.
maybe one day I can go back into exploring that option.
Yeah, but at least you know you got a job in your pocket at all
Right,
times.
right. Hey, you always got to have a job in your pocket. So right now, if you just coming in, once again, I'm 6'5" mirror mirror. That's 6'5" in real life. We're here with G Way, G Way or no way. You could catch him on the tag that. Make sure you hit him with a fave. Make sure you hit me with a fave also. And right now, G Way, I'm gonna take you down, and we're gonna bring up our next guest,
For sure.
and then we'll continue from there. All right, hey man, you guys check out G Way again. Definitely a cool dude. Make sure you hit him with a fade. So right now we're talking about the transportation industry and the medical industry. So right now we're going to bring someone up from the medical industry that I know, and she's going to come and touch on a couple of topics on the same thing, how the medical industry was affected before and after COVID. All right, we got Maria. What's up, Maria?
What's going on? Happy Sunday.
Happy Sunday. Happy Sunday. So, everybody, this is Maria. Maria, can you introduce yourself? Tell us a little bit about you, how you are on tag, where they could find you, and what you do for a living.
Sure. I'm a troll on tag. You will not catch me streaming, but you can definitely catch me here in Mirror's Live or G-Ways Live. We do have our playlist battles on Friday at 9. And other than that, I'm really just a supporter for the most part. I have 16 years in the medical field and 2 years thus far in dentistry as a hospital administrator. So my career goes back to hospice care, where I originally started, all the way to the pediatric cancer unit, to running the department of neurology, to now overseeing a large affiliation of dentistry.
Okay, okay. That sounds like a lot. You're definitely needed out here. Definitely needed.
Thanks.
Do you remember when COVID first hit and how it pretty much how it was announced and how you felt when it was announced, how it affected you when you first heard it?
So, when I first heard about COVID, I was a director at the hospital, one of the major hospitals for the area, excuse me, that I live in. And it was just random rumors at that time. Working side by side with at least 25 physicians, 18 residents, they all had their vast and different opinions of what was actually happening until the capital where I live of New York actually announced that it was official and it hit home. For many people, they know that it hit New York City the hardest, and we just didn't think it was going to touch us, being though we're only a few hours away, and it certainly did. So I was at work when the news hit that things were about to change.
Okay, okay. So, pretty much, you're pretty much saying you were a valued worker before COVID, and you're still a valued worker now. Do you feel like they like you're more important? Do you feel like your job values you more now than they did before, or does it feel the same?
Honestly, as an administrator, I don't think we were valued before or after. But I can certainly speak, or I hope I could speak for the people that I took care of. So I had a series of RNs, LPNs, CNAs that worked underneath me, nurse practitioners, and physicians as well. And their value has always been there because health is not going to go away. Your issues in health is not going to go away. But talk about the demand of services, it was exhausting, truly. And I think they are some of our unspoken heroes, people that are working in the medical field right now.
Definitely, definitely. I know it's definitely a scary topic when the COVID first hit. everybody's freaking out. We were seeing the numbers on the news just continuously moving. You know, we didn't know if it was real or fake. We just, everybody was just in panic. So I definitely understand that. Um, so when it comes to like being with your family during COVID, did you separate yourself from your family or did you still be around them? How did that work for you? Because you're directly in the midst of the fire in the health industry.
It was hard. I'm a single mom, so my biggest concern was my child. And I'm very thankful that my mom has a daycare and I've been blessed that she's been able to take care of him. But I got hit a couple different ways. I was considered and called a walking virus by my own mother, who told me to stay away for the holidays and made it very difficult for me to find childcare. She was unable to watch my child for a period of time, um, because I was in such close contact. Now, on the other side of it, very respectfully, my father did ask me to stay away from his mother, who was ill and sick, and not be around for the holidays. So it was hard. There's two different ways to go about it. There's a very direct way, and there's an indirect way. Understandably so, a lot of people were scared. They didn't know they didn't know how you were going to get it, what was going to happen if you got it, what the underlying conditions were, considering diabetes is such a huge factor in multiple communities, affecting ages in all ranges. You don't know what the side effects are going to be, and lots of people were dying. I can't do anything but respect that fear. For myself, I couldn't have fear. I didn't watch the news for months. Actually stopped talking to one of my close friends who is a RN for our competing our a different hospital down the block from me, um, because she was in it. There's a difference between inpatient and outpatient clinics. So I oversaw a department that was located in the major hospital, but let's say my office is here and the ER is over here. There was vast spaces. I had my own private entrance and I wasn't really in contact with direct patients that needed and were seeking help. But granted, we were one of the first pillar offices and hospitals to start doing the car testing in our area. So we constantly had people driving or walking up to these clinics that were around us. So it was nerve wracking. But being an admin, I couldn't really display fear because everybody else underneath me was terrified. They didn't want to come to work, but they were also trying to figure out how they were going to provide for their families. They
Right.
didn't
They're
know
looking
if
for
we were going
you
to
for
have,
strength. Yes.
yeah. So it was just a lot to have to handle. And for me, I couldn't afford the luxury
Thank
of
you.
being
Thank you.
scared or nervous and seeing what was going to happen next.
Definitely, definitely. Once again, everybody, if you just tuning in, I'm 6'5" Mir. That's 6'5" in real life. I got Maria in the box, and we are talking about the social norms and things that changed in the medical industry. We named a couple facts, like before 2019, we had 22 million registered nurses running around here helping us every day. But as current date, we're struggling in the field, and we have about 5.1 million today, and we need help. COVID definitely has changed our lives, and we're just touching on a lot of those subjects. So, Maria, do you know about a lot of the policies that were in place before COVID and some that are now? So, that I mean, there's been policies that have been around from the Stone Age. Like, has anything changed? Did they implement new stuff, or are they still using the same textbooks they've been using forever?
Well, policies were changing constantly. I mean, every single day there was a new guideline that we had to follow, new rules that were being made. Um, what I can say about working through the whole COVID experience for myself, I felt secure and comfortable in the people that were around me. I was very grateful to my director of nursing was one of the women and one of the individuals in the Capitol room with the mayor, with the governors, talking about what New York was going to do. Some of the doctors that I worked with who are specialists in other areas were also there. Like my own director of neurology was also there. So I have a different perspective than I think a lot of people do. So I'm really, really grateful for that. Um, but it was hard trying to keep up. One day were allowed one visitor in the room. The next day, we weren't allowed anybody in the room anymore. I mean, just as simple as people trying to see and visit their loved ones, it was hard. Masks was an issue. It still is an issue. Should they wear them? Should we give them out? PPE was a problem. Sometimes you can be kind of laxed. And then, it's hard dealing with someone that refuses to wear a mask and then something happens like this and they're demanding 4 or 5 different masks. They can't be safe enough anymore. So the guidelines were constantly changing. I think the best thing that came out of COVID directly was actually virtual care. So being able to do something like this and have a consultation. Um, Not every specialty that's able to do. But it's actually something that in my profession career, they've been asking for a long time. So when I was working with a psychiatric facility and doctor, his thing was he wished he was able to do virtual visits to outreach some of the places that are not close to us. We have a lot of remote areas here. New York is a big state. And that was just not something that insurance companies were willing to pay for. So you have to factor in the fact that no matter how much a doctor wants to do, sometimes he's restrained by what insurance companies are willing to pay. Because of COVID, they said, go ahead. They said, figure out how you're going to get online,
Figure it
figure
out.
out how you're going to do it. We're going to pay you regardless. And it was such a pillar within the industry. A lot of people are like, there's no way a doctor's going to be able to diagnose me. Well, if you have a strange scar on your arm and he tells you to do this, or he tells you to do that and do some physical forms in the office, it's the same thing. He can still see the same thing. Um, but it made it hard when we were losing people left to right, doctors included, because some doctors have been and were close to retirement anyway. And then we had to shut down surgical units. People that had been waiting for transplants, people that have been waiting for brain surgery, for biopsies, for just MRIs for months, sometimes years. And then you go from having 20 operatories to two because only two doctors were willing to do it. Um,
Yeah.
I think virtual was the best thing that came out of it. People were able to actually get help and not have to leave their house, which was great. And they're still doing it now, which is even better. Um, but as far as everything else, it was just a struggle trying to help people. And thankfully, at least the ones that I work with, that was the majority of what they wanted to do, was just being able to help. Everyone in my unit, we didn't have to furlough anyone. We did have to rotate them out. I had to excuse 1/3 of my team regularly for 2 months, but they gratefully were able to be paid. And a lot of people didn't have that experience.
Yeah, definitely, definitely. Everybody, make sure you hit Maria with a fave. I'm 6'5" Mirror. We're talking about how times have changed in the medical industry right now. If you know somebody that was in the medical industry, you know exactly how their life has been changed, if it was for the better or the worse. So right now, we're just touching on different topics that, the new normal. That's pretty much what we're talking about, the new normal. So, Maria,
Hmm.
can you tell me from a standpoint as a manager, how's your experience been with your employees directly? Like, have you had any employees like do anything wild, just walk out, in tears or anything like that?
Yeah,
Before, I
I
mean, you've been
sure
doing it for
did.
16 years, so I'm pretty sure you didn't seen a lot, but
I've
you
seen a
know,
lot. Oh, I've seen so much. Some things I definitely
thank
cannot
you.
unseen. Most of the time, the freakouts were by patients, and just having to de-escalate the situation. I had two walkouts on my unit once. Um, the first walkout was about a week after COVID was announced, and the hospital was trying to decide how they were going to protect our staff. We had adequate amount of PPE. It was just a matter of trying to make sure people were going to wear it. For a hard part of the time, we were fighting for partitions, those little plastic things that go at the front
Hmm.
desk. And we did run out of material. So I had some people at my front desk who, didn't want to wear a gown because they didn't, they wanted to show off their outfit, and wanted surgical masks, even though they were not qualified to wear surgical masks because they're not surgeons. Um, so my entire front desk of 5 walked out. So I ran the
Oh
day by
man.
myself, and I had one physician that saw a patient or 2 patients every 15 minutes, so a total of at least 200 people that I had to check in and check out by myself. Um, that is part of being an administrator. The second
Man.
walkout, the second walkout, after people came back and they understood their guidelines, and we started circling out 1/3, and they knew they were getting paid. Someone came in, an employee, who they were supposed to have reported that they were exposed, and they didn't. And then because someone else that they were exposed from reported their name, because there was an entire process of every day checking your temperature, doing symptoms, a checklist that had to be submitted, um, because you did get paid by the hospital at that time to be out. This person decided not to report it and then showed up on someone else's investigation. So I had to pull them in and I had to send them home. And because they are friends with everybody else in my unit, I had 30 employees and 17 of them walked out. That's from the
Oh
front
man.
and from the back office, because I didn't send the email out exposing this individual because it's a HIPAA violation for me to do so. So it's great being an admin because you get to be I don't regret any day of my job. Let me just make that very clear. Um, I like being that bridge between people and policies and making it a nice environment to work in, but it was a struggle. It was a struggle trying to understand the policies myself. It was a struggle trying to implement it. And then you have all these other factors. And the biggest factor was fear. I was just having lunch with her. Why didn't you tell me? I cannot expose someone. It is a HIPAA violation. So I didn't want to lose my job either. So she sent a mass text message out to a few of them saying, "Oh my God, Maria's going to fire me." And I didn't. I just sent her home. And they're like, "Why?" And she said, "Because I tested positive for COVID and I didn't tell her." And they all got mad at me.
Hmm. Hey
So
man, you
managing
got to do
people is
your
not that
job. You
fun.
got to do your job. Definitely.
Gotta do
Hey,
my
they get
job.
mad, but you got to do your job. I
Yeah.
know from you know experience. I was in the entertainment industry, so I used to do security for rap artists and singers, and I worked in nightclubs. So when COVID hit, it was like they posted a mandate on the door and said, "This is the last day you guys have to be in this building, and after that, it's it's over." So there's no music going on, there's no bars open, there's no clubs, there's no lounges, none of that kind of stuff, no social gatherings whatsoever. So the entertainment industry completely fell apart. Nobody had jobs, and this was the only skill that we had. So it's like, I'm a security guard. Hey, I can find another job because there's other security stuff opened up due to COVID. Now you had to watch testing sites, and there were other things offered. But for other people, like, people that worked with like serving, event serving, alcohol service, planning birthday parties, they were unable to do any of these things. They had to find different careers. So all that promoting, definitely everything just completely stopped, and everybody had to pick a new career. So I definitely been affected by it. I've changed my career 2 times since COVID. I've done jobs that I'm like, I never would do that job, but I had to put food on the table, and I never stopped working. I worked all through COVID. I didn't get that break off. And before COVID, it was life was regular. But COVID actually was a blessing for me. If it wasn't for COVID, I would have never found the job that I'm with now. COVID actually pushed me to put myself in a better position in life. It put me in an uncomfortable situation of like, all right, look, if you don't find a job, you're going to starve. Your family's going to starve. So it definitely made me snap out of it and get to work. So right now, I want to bring G Way up back up, and then myself, you, and G Way, tackle a little situation, another question or two. You know, once again, everybody, I'm 6'5" Mirror Mirror. This is Times Remembered, things that we remember from before and after the coronavirus. If it's affecting us now, how it affected us before, and how it is affecting us today. I got Maria in the box up top, and then I have G Way here also. Make sure you hit them both with a favorite. They're streamers on tag. Maria's a streamer too. She just pops on here and there. And G Way, he does his thing also. So for you, Maria, what do you feel? How do you see the future of, you know, at post COVID becoming like the social norm? Like, how do you feel like now that COVID's been going on for a while and it's kind of like normal? Like, it's not normal, but where it's kind of normal. People are, you run out the house, you grab your wallet, you grab your keys, and you're, oh, snap, I forgot my mask, you know? So now everybody's like Ninja Turtles out here, you know? We got to have our mask on, you know, everybody's suiting up like Avengers, you know, like Avengers, let's go, grab your mask, you know, grab your keys, you know? So how do you feel about that?
I feel a lot of different ways about that. So I know the biggest struggle during COVID, because a lot of people think COVID's over. It's not. People are still traveling, holidays, people are still sick. You know, pneumonia is real, the flu, cold is still real, and now so is COVID. Um, so a lot of people were chasing to get back to that normal life. But honestly, COVID exposed so many things during this period of time. Me personally, and it is just my personal opinion, we are finding a normal now. I don't think we've ever actually had one previously. With COVID and the fact that it exposed, you know, some highlights within Black Lives Matters, the presidential debates and situations that we had going on. I was experiencing two union strikes at the same time during COVID. And then, like with G Way, you know, they deemed him core essential now, his whole production, but there's been people that are pillars into making everyday's lives easier that a lot of people just ignored. I think COVID highlighted so many different factors that were being hidden underneath now that we are now experiencing the new norm of people coming out and
Definitely.
actually saying who they are, what they stand for, what they believe in. You know, it goes even into like the trans community. So it's an all over, this is now our new norm. Be who you are, be real about it, and just celebrate it because you're not going to be the only one. As far as the political debate over masks, like tomorrow I'm taking a a vote with my team. Are we going to allow patients to no longer wear a mask in our office? The doctor and I decided we're going to leave it to the team. Clinical still has to wear a mask because we're working in people's mouths, now that I'm in the dentistry field. But a lot of people are still fighting whether they have to wear it in the hospital or not. And people are no longer wearing masks at the airports anymore. And people think that they're going back to this new norm, but it's just as simple as someone else getting sick and you not knowing it, or someone going out into the public instead of protecting themselves, because that's all, in my opinion, a mask does is protect you from yourself, and then it can just rise up again. So if anything, the norm that we should have gotten out of COVID was people standing on what they believe in and just doing exactly that. Stand on what you believe in and expose the
Definitely,
things that need to be
definitely.
exposed so people actually are aware of what's going on in the world now.
Due to
That,
times in the United States and other countries, one thing we can say as a human race is that we are definitely adaptable. We adapt to changes every kind of 100 years or so. It seems like we have some kind of epidemic or pandemic that we have to adjust all our lives to, and we pretty much get right to it, you know, and we make the adjustments and we get back to work. You know, COVID was definitely took us by surprise, but I mean, we're making a step in the right direction. G Way, how do you feel about the situation? Being that today now it's like the normal thing for you. You know, are you still experiencing like stuff like COVID? Is it holding you back still, or is it holding your the industries back? Is it is
No,
it
not.
regular for you?
It's the industry has gotten somewhat back to regular, but with other things that's going on, like the Ukraine situation, the fuel is ridiculous. It's really ridiculous. But the crazy thing to me that I see is kind of like Maria was saying, there's so many people walking around without a mask, like everything is just okay, all right. And with me going from one side of the country to the other side of the country, it's so different. Because if I'm on the East Coast, I see no mask. Like Atlanta, Charlotte, Virginia, up in that area, all the way over till I get to about the middle of Texas, about Houston on over, they got masks everywhere. You be like,
Yeah.
dang, like I was just over here. I ain't see a mask for 2, 3 weeks.
I'm
Over
from
here, everybody's got
California,
a mask.
so it definitely
Yeah, yeah. They still
California,
rocking
Southern
masks.
California, they don't wear a mask, but Northern California, like the San
They do.
Francisco area, and they act like COVID hit yesterday.
Yes,
You know,
they do.
so you can't go nowhere without a mask. You can't walk in a building. You walk in a building, get out. They point
Yeah,
you straight
they
out.
still putting people
You
out.
could buy a mask. You put your money on the floor. They'll put the mask outside, and then you can walk in. You know, so is the mask thing, PPE is definitely a big thing. Some people wear it, some people don't. So
Right.
um, I mean, I carry a mask around. I've been vaccinated, so I'm not too worried about it. But people are still catching coronavirus with the vaccination and everything too. So and that's good that you wear yours. It's really a personal
Exactly.
preference at this time, because do you want to wear it or do you not want to wear it? Are you protecting yourself or you feel like you're protecting yourself from other people? So it's really one of those situations.
Yeah, I have
Another
patients that are
question.
threatening to
Go
like
ahead,
leave
Free.
my practice because we still have mask mandates in our office, and my
Oh
whole
man, yeah.
team knows how I feel. My kid gets dropped off at my job and he goes straight to the basement, and I have to think about us being in close counters, and I'm still in that mindset of, well, what's the hospital doing? And our hospital's still wearing masks, and people are taking their care elsewhere because they don't want to wear it anymore. It's a personal
Yeah.
preference at this point.
It is
Yeah.
now. It definitely made a lot of people feel uncomfortable. It was tough when we had to send our children to school with masks. They put kids in little bubbles. You ever seen the movie The Bubble Boy?
Yeah,
They put
that's
Yeah.
us
a
in
classroom book.
everybody's little bubble, and it was like, here's your schoolwork, do your schoolwork. Everything was online. It was up to the kids to do their own schoolwork, and there's definitely a lot of children. Education has definitely been another impact, with
Yeah,
this situation,
that's true,
learning before
JoJo.
and learning after. So it's definitely been changed. So I have another question for you guys. Um, so, what do you feel like the biggest social impacts for you have been, and how has Tag played a part in that? Go
It
ahead,
definitely
Maria. I know you want to
changed.
jump on it. Go ahead, G-Way.
It definitely changed the social impact. It definitely changed the internet and online dating. Because before COVID, I mean, don't get me wrong, online dating existed, but now these days, online dating is serious. It's very serious. Like you're
Yeah,
getting to know everything about that person literally before you even think about meeting. And are you vaccinated as part of the conversation before you even meet them? So it's definitely changed a lot. The internet is way more powerful, in my opinion, since COVID. Definitely.
right. We have so many different social media platforms, so it definitely becomes like a Q and A. When you would ask 21 questions before, like 50 Cent, now it's like they send you over an application and you got to fill the application out before you guys can continue in a conversation. So,
Right.
and normally before it's like, okay, where do you work at? And if you tell them that you work at a hospital or something, that conversation is done. Like if you work anything with close people, your chances were kind of low with those people. And I know Maria could probably speak on that.
Sure
So
can.
Maria, same question for
Probably why I'm
you. How do
single
you
now.
feel like it's been? Hey, single is a choice. Single is a choice. But yeah, so the social impacts for you, and how has Tag helped also?
Um, well, during COVID, I didn't have time to be social at all. It was a demand. It was long hours, long meetings every day. I was barely social with my own child, so it was very difficult. I didn't actually get on tagged until after I left the hospital and after COVID settled down a little bit. So I'm pretty new to the app, so at least a year now, but that's still new compared to what I've seen, which was a lot of people were home and were able to get online and go live and create these forms and bonds and relationships. I'm not saying that they didn't have other things to do, but there was a period of time where people were sheltered and locked in a home, and I was enjoying not having traffic and could park anywhere I wanted and could speed down the block, and no cops were going to pull me over every day. So for like a
Right.
good year and a half. Um, so the only social aspect that affected me was being away from my family because I worked in a hospital, and according to my mom, I was a walking virus, even though I was nowhere close, and I actually personally have never contracted COVID the whole time that I was there and after, and neither did my kid. So I was really grateful for that. Um, but I was telling a little bit earlier, my best friend who was a nurse in a different hospital, she worked overnights and she worked hands on hands with patients. And she would give me a breakdown of her every single day, stripping out the door, putting different clothes on just to go in the house, just to shower, just to wash everything every night. Um, and with all the other things that were going on with like the gun rights and the shootings and stuff like that, she became so overbearing. The one person that understood everything I was going through every single day was so terrified I had to stop talking to her for like almost 2 months. And she understood, she was afraid. And I was just like, I can't be afraid. I have to go in there and not be afraid for 75 of my staff members. I can't hear about what's going on, and you go into Walmart and getting bullets and toilet paper. I can't hear it. I can't hear it. I
Yeah,
love you. I'm
definitely, definitely.
sorry. I have to separate. So that was just,
Yeah, COVID
I
has
had to
changed
isolate
us
myself a
definitely.
lot. That was the hardest part. So,
Yeah. So I appreciate that. I appreciate that. You guys are definitely, you're from two different industries, but they're connected and they're far apart at the same time. One that's they're both essential workers. And we definitely need both of you guys. We need the hospitals. The numbers have, oh yeah, the toilet paper. Yes, they were definitely running out, grabbing toilet paper, milk, and all
that was
that stuff. It was
wild.
wild. Yeah.
So,
So
okay.
now G Wade knows about that. I'm pretty sure he was picking up toilet paper loads.
Oh,
You
there's
know.
people getting robbed for toilet
hmm
paper out here,
Oh
man.
yeah,
Believe
they're
it or not.
they're they're holding. I've seen stuff. They were holding up trucks, for toilet paper and all that kind of stuff.
Really?
Checking.
I didn't
They
watch the
have
news. Seriously?
yes, ma'am.
There's,
They have
Oh, wow.
tankers inside. In like the LA area, they have like the containers where there were supplies at. And people had to make sure they watched the supplies and stuff too. But
That's
once
crazy.
again, everybody, look, I'm 6'5" Mir. This is Maria. This is G Way. And, this is how times have changed. Maria is in the medical industry. She's an admin in the medical industry. G Way is in the transportation industry. And, they're explaining their experiences and how they see things through their eyes on before and after COVID. Now, COVID isn't really over. There's still a lot of things going on, so it directly affects us still to this day. But right now, we have things going on that are like normal to us. Now, I've been grabbing a mask as soon as I walk out of the house for months now. So now it's like you don't leave home without it. And there are certain things that you do at work, whether it's a handshake or an elbow or just a nod, greeting each other socially. We get on this app and we talk to each other necessarily because we can't meet up in person. We talk to our family through social media a lot more now also. So it's pretty much, been the new normal for us. A lot of the viewers in the chat have, stated like, hey, I was doing that also. These things happened to me too. And it directly affected everybody's life. And it will never go back to normal because now it's a new normal. Some people can't even think about how it was 5 years ago now. COVID has implanted so much of a new thing to your life that now you can't even think about things you were doing 2 years ago. Did you actually wash your hands more? Did you not wash your hands more? Did you text your mom or did you go to her house and knock on her door? So things like this are are normal, or they're not normal, or they're the new normal. So here on this show and episode, we like to discuss things like that, have how they have changed because time is continuously changing. So I appreciate you two coming through.
Oh, yeah, no
It's
doubt.
been a great pleasure. We will definitely have another conversation. And
Absolutely.
I appreciate you guys. Thank you, viewers, for coming through.
No doubt. No doubt.
Shout out to the tops, that have definitely came through the show. Make sure everybody fade Maria and G Way and go and check them out. G Way, you said that you are co-host on the show, right?
Yeah, I co-host quite a few shows. You can catch me Saturdays at 10 p.m. Eastern Standard Time on the Red Room Talk. That's one feature show. Getting Lit with King of Diamonds on Thursdays at 9. This Monday, you can catch me on TT Mama Show, Wow Factor at 7. Hot Topic Tuesday, Orello at 9. Just tune in with me, fave me. Please follow the Instagram. I got something pretty much going on every night. So if you
Yeah,
don't
yeah.
like
And
me,
I
I got
heard you
something
do
you'll
a
like one day.
I heard you do a nice Manchester impression. I think I heard that. I think I heard that one day. I came in and
Yes,
you were
if
giving a
you
nice.
doing that in Getting Lit last week, rather interesting.
Oh
Right.
my
So if you can
gosh.
see, G Way is a character, and he's one of the many personalities on the Tagged app. So make sure you tap in with him definitely. What about you, Maria? Where can we find you at again?
You can find me here in Mirrors Live or G Ways, actually. Uh, don't really stream like that, but it's a huge supporter of the app and huge supporter of the streamers. Um, the only thing that I'm really involved in regularly right now is actually with G Way doing his playlist battle, which is always a vibe. Mainly we do R&B music, but we be switching it up. And if you love to listen to music and hang out, definitely come through Fridays at 9. You will find me, and if you think you can beat my playlist, I dare you to try it.
Right.
Definitely, definitely. Get your playlist together. Go through them songs. We want to hear songs from the 80s and up, probably. We don't go back to the 1940s or
Oh no,
nothing,
we go
you
back.
know.
Oh, we
But
go back.
we go back,
We
definitely,
go back.
definitely. So look, check these two out. Two great streamers, good friends, and we out of here, you guys. Thank you for watching, and tune in to another episode. I will post it up so everybody know when the next one takes place. I appreciate you, G Way. I appreciate you, Maria. It's definitely been fun and educational, you know. So definitely. One of the biggest things for me too, I didn't even speak on it, was the restaurants. When you go to a restaurant now, you can't go in and sit down at your favorite restaurant. Man, that hurt. That definitely hurt me, man. I don't know how it was for you guys, but it definitely hurt me. Can't go down and sit down and get a nice steak, you know, they slide the steak under the door and stuff these days. Like, here you go, sir, and slide it on through a little. They open up the latch and just slide it on through for you. Like, here you go. It's like, sir, you forgot the butter and the knife. And they give you the little plastic butter. Like, how you gonna cut a porterhouse with a butter knife? You know, but hey, hey, look, hey, a lot of things closed down, and it definitely affected everybody. Definitely affected everybody. So I appreciate everybody coming again. I'm 6'5" Mirror, fave everybody in the chat and all that good stuff. And we are out of here, man. It was a pleasure.